When men get older, the prostate grows naturally. Usually happens in the late 60s, 70s, and most men in their 80s have waterworks problems or urinary symptoms, as we call it, and that's a natural process. We don't quite sure why the prostate enlarges, but it's observed in about 50% of all men. And when men observe symptoms, they would generally consist of going to the loo more, maybe getting up at night, more than twice a night, having to rush to the toilet, and sometimes even getting caught short. Often men with enlarged prostates have to go twice, back to back, and so they have to stay in the toilet longer, and passing urine could take longer than normal. All mammals have the same voiding time, including humans, which is about 1 minute for a normal urination. So these are the general symptoms that one would expect. There are more subtle symptoms like a slow flow, but because that happens over many years, men usually consider a reduced speed of the water flow a normal development. So prostate is an organ that is deeply embedded in the male pelvis. Women don't have it, and it wraps around the water pipe. So the urethra, which is the technical name for the water pipe, is runs right through the middle. So if the prostate enlarges, there's more resistance to the urinary flow, and the bladder, which is basically a spherical muscle, has to push much harder. Now, when a muscle pushes harder, it gets bigger or thicker in the bladder specifically, and it starts twitching. Now, that twitching is what men perceive as having to go to the loo more frequently or more urgently. And so an enlarged prostate is probably the most common condition, which the doctors refer to as benign prostatic enlargement. Sometimes you hear the terms BPH, which is more a technical term derived from looking at tissue and cells under the microscope, or we call it often bladder outflow obstruction. You might see that in doctors' letters, which basically refers to the whole water pipe, not just the prostate. There could be spasm of the muscles that hold the urine, could be stones jumped in the water pipe, there could be scars in the water pipe, or a very tight foreskin, sometimes in young boys or very old men. So this can all cause problems to the waterworks. And that's all benign or non-cancerous conditions. There's the other group of conditions which are related to cancerous changes in the prostate, and that would be also a very common condition in an aging man. It happens in about 1 in 8 white men and 1 in 4 black men that we develop prostate cancer. Depends on our lifestyle, on our dietary habits, our weight, and our family history. But mostly we think it's just bad luck, and the fact that we get very old these days, and often cancer is seen as part of aging, specifically prostate cancer. Some prostate cancers are seen as part of aging, and despite us finding them, we often don't really treat them proactively. We observe them for quite a while just to see, do they really need treatment? Now, the problem with prostate cancer, for instance, is that these small cancers in the prostate do not give symptoms to men until they are very big and are difficult to cure or have spread to other body parts, and then they're definitely not curable. So it is important to have regular prostate checks, just like women have checks of the cervix and have their screening of the breast from quite a young age. For men, that's not so important. Usually we start at 50 or late 40s, unless there's a very strong family history of breast, ovarian, and prostate cancer. Then we start a little bit earlier for men. But men are generally not frequent doctor's attenders because they don't have babies and because they don't have the gynecological screening that women get. So unfortunately, we find a lot of these cancers at a later stage, which is often regrettable because they can be cured quite easily, often if found at an early stage when these tumors are contained within the prostate. Generally, prostate health, we don't quite know why the prostate enlarges, so it's very difficult to pin that down. But there are the general rules apply to the prostate as they apply to the rest of the body. So we would like to recommend a healthy diet with lots of vegetable components, lots of fiber, and lots of vegetable protein. We know that vegan diets reduce the cancer, generally the emergence of any cancer over a lifetime. So we know that these non-meat diets are healthier. Of course, it's very difficult to stick to them sometimes. So a reduction of red meat, specifically a reduction in processed red meat, is paramount because of the fat content and because of the preservatives like nitrates in ham and bacon, for instance. But of course, red meat on its own also is processed in the bowel and causes cancerogenic waste products, which is a result of the bacterial digestions of the protein. So reducing meat is important, and that applies for most other cancers as well. Perhaps increasing the intake of cruciferous vegetables, which are broccoli or cauliflower, very helpful. We use herbal extract often for prostate health, to increase prostate health. They're called sol palmetto, and sol palmetto is a Latin word. It's the name of the serrated palm. And so this herbal extract is usually sold in health food outlets. In the UK, it's, for instance, Holland Barrett's and Boots, and they come in different preparations, usually as a capsule per day, and they are combined with antioxidants like vitamin E and C and trace elements that act as coenzymes in the prostate, zinc and selenium, and a few other herbal remedies in there as well. So they have been shown to be quite helpful, calming down inflammation in the prostate and managing symptoms. And in fact, in many countries in Europe, like France and Germany, they are first-line treatments. In England, we tend to use prescription drugs, but so it is certainly an option. A good fluid intake is important for the health of the lower urinary tract, which is what we call the bladder and prostate and water pipe. Just because flushing through the bladder with urine is the main defense mechanism of the human body to avoid urine infections and prostate infections. So if a person is dehydrated chronically, doesn't drink enough, then there's a much higher risk of a urine infection. Now, of course, in a woman, a urine infection is more frequent and can be easily treated. In a man, a urine infection is always considered complex because bugs, organisms, bacteria, they don't really migrate easily along the 24 centimeters of an average male urethra into the bladder. So they have to come from somewhere, and there have to be predisposing factors, and that's why it's considered a complex infection, and that means that the doctors generally have to investigate why a man gets a urine infection or prostate infection, rather than women who we don't investigate because we accept that because of the short urethra, they have a much higher risk of cystitis, and we just treat it and then move on. So men will have to have an ultrasound scan, usually an examination, often a blood test for the prostate, to get an idea why they develop a urine infection. Now, once a man has a urine infection and is not properly treated or treated with the wrong drugs, then the bacteria usually escape and hide in the prostate. Prostate is a perfect hiding place for bacteria because it has a compartment where the semen is contained, and semen is protected from our own immune system. Semen contains sperm, and sperm only have one set of chromosomes. So our own immune system would attack our own sperm if they were not sheltered in a compartment. Now, bacteria have learned how to explore this, and they also hide in these compartments. And that's why it's really difficult sometimes to get to these bacteria in the prostate and treat them with antibiotics. An enlarged prostate can be a serious condition. So this is generally what we refer to benign enlargement, so non-cancerous enlargement, which happens naturally with age. So about 50% have symptoms of benign enlargement. Now, there has been a study in the States 30 years ago, the Baltimore longitudinal cohort study. So it's a lifestyle study where men were followed up for many years, and amongst other things, they were asked, their prostate were assessed, and they were asked about their symptoms. And it transpires that about 30% of men with enlarged prostates have symptoms that will deteriorate in the next 10 years. About 30% stay just the same, and they could theoretically manage it with the lifestyle changes, maybe herbal remedies, and 30% get better on their own without any intervention. So it is not a serious condition. It can be, and it should be, managed conservatively with lifestyle changes. In first instance, that means dietary changes, good fluid intake, maybe weight reduction, exercise, and avoidance of irritants like diuretic foods with diuretic properties, like alcohol, tea, or coffee before bedtime. So that's obviously a reasonable thing to do to avoid urinary symptoms at night. So that can be managed conservatively. And for the men who have symptoms that really they feel are bothersome, and that's the term we like to use if there are symptoms that have an impact on quality of life, which cannot be addressed with lifestyle changes. They need to see the doctor, and they need to have probably treatment, because quality of life changing symptoms, like for instance getting up at night too many times, 3, 4, 5 times, can lead to sleep deprivation, and that can lead to depression, anxiety, underperformance at work, or in very old men, it can lead to falls at night. Falls in old people are very, very dangerous because often it leads to fractures of hip, large bones, predominantly the hip, and they are very dangerous, obviously, and take people to hospital for many weeks. And so we try to avoid that and address that. So these people who have significant symptoms affecting quality of life, they need treatment. So if you observe symptoms, as we discussed earlier, like slow water flow, going stop and go when you go to the loo, you feel that you can't empty your bladder, you get up a lot at night, you have to rush to the loo, you see blood, or you have urine infections, you need to go to the doctor. If you have discharge from the penis, you need to go to the doctor. There's no doubt. Generally, if you're over 50, particularly if you have a family member, a first degree or even second degree member, relative with prostate cancer history, previous treatment, breast cancer, ovarian cancer, you should consider having this blood screening test like the PSA to make sure that it's not elevated, because nowadays it's very easy to have that test. It's very, very cheap, and we can do an MRI scan of the prostate, also very affordable and quick, and that would exclude prostate cancer pretty accurately with the current technology. So I definitely recommend that. Now, of course, different countries have different guidelines, and in the UK, prostate cancer screening with this PSA test is not recommended at this moment in time, because the evidence is not universally in favor of screening. Now, the doctors would say that the PSA test is a very cheap test, it's quick, and if you and the doctor are well informed, then having a test is very reassuring and a very reasonable thing to do. So if you can have it, do have it from the age of 50. If it's very low, so less than 0.7, you probably don't have to have a test for another 5 to 10 years. If it's 1.5, then maybe repeat it once every year or every 2 years, and make sure it doesn't rise. If it does rise, then get a referral to a urologist for an MRI scan of the prostate. That is generally our recommendation, professional recommendation, because we can find them so easily now at an earlier stage. And of course, when you find cancers at an earlier stage, you have treatment options that are less harmful and have less side effects, cause less collateral damage to the rest of the body, which is, obviously very important, because most men in their late 60s or 70s want to maintain their quality of life, and they don't want to suffer the after effects of cancer treatment. They want to enjoy a happy retirement without any symptoms, ideally. So the smaller the treatment, the less side effects, the better. But of course, you have to find these tumors, which are normally silent and don't cause any symptoms, very early.